Now we're going to do the Fallon test. We're going to do this by taking the back of each hand and putting them against each other like this. And we're going to hold this for 90 seconds. Try to make your elbow 90 degrees. Okay. Okay. No symptoms were noted, so that's normal. Okay, now we're going to check range of motion of the hip. First thing I want you to do is raise each leg with the knee extended. So raise it in the air a little bit straighter though. There you go. Like, you can raise this up as good as you can. That's good. Okay, now back down. And do it with the other leg. Okay, back down. Alright, now I want you to bend each knee up to the chest while keeping the other leg straight. Good. The other leg. Good. Okay, now I want you to flex knee and hip to 90 degrees. Stabilize by holding the thigh with one hand and the ankle with the other hand. Swing the foot outward, swing the foot inward. Okay, so I'll show you this. Okay, I'm going to do this, and I'm going to bend it this way, and bend it that way. Okay. Now I'm going to bend this one this way. That way. Good.
I think I want to do that.
Okay. And now we're going to check on this side, and we'll turn around and check on the other side. Just relax your leg. Try to bend it, move it out this way, and then move it in past your other leg. There you go. Do it again. Okay. Good range of motion noted in the hip joints. Now I want you to take and swing your leg in front of you. You can. You can do the other side. And then behind you. To the side of you. You can hold on to me if it helps. We're just checking the movement of your hips, so not really your balance. So try doing it again. There you go. There you go. Good. Okay, so range of motion in the hips is normal on that side, and we'll check the other side as well. Okay, now we're going to look at the knee joint. If you look at it in appearance, on inspection, the skin looks smooth with even coloring and no lesions. The lower leg alignment is in the same alignment with the axis of the upper thigh as well on both sides. Now we're going to inspect the knee's shape and contour, noting any distinct cavities or hollows within the knee. We're going to check for fullness or swelling along the knees as well. And we're also going to check the color and temperature as well. I don't feel any swelling or fullness. Temperature is pink and warm. And no cavities or hollows noted either. The contour and shape of the joints are symmetrical on both sides. Is it tender to palpitation?
No.
Okay. Now I'm going to palpitate the knee and the surrounding muscles.
Yeah, great.
I don't feel any I don't feel like it's swollen. There's no nodules noted. Muscle consistency is normal, and temperature of the skin is warm, and the skin is pink, and looks symmetrical on both sides. Now we're going to check for bulge sign to check for fluid within the knees. None was noted, so that's normal. Okay, now I need you to bend the knee. Here, on the hand. And extend it. Go straight down to the ground. Okay, now do it on the other leg. Good, so range of motion in the knee is present. Okay, now I'm going to try to pull or push your knee towards you, but I want you to push against me and try to keep your knee flexed, okay? Good. The patient was able to maintain knee flexion, so they have good muscle strength in the knee, and we'll check that on the other side. Okay, now we're going to inspect the ankles and foot while the patient is laying down. We're going to look at the skin characteristics and make sure that everything is the same color. As you look, you can examine that the midline of the foot from the heel along the midfoot and between the second and third toes look normal. We're going to check for flat feet as well. So as I inspect the feet, they align with the upper axis of the ankle on both sides. The joints look normal. There's no swelling or tenderness noted. Color is slightly cool, or not cool, but this temperature is slightly cool, but color is the same throughout. There is some along the toes, some of the joints are slightly enlarged in comparison to the other, and the toes deviate inwards instead of being midline with the feet. But besides that, no bunions noted and no lesions present. No swelling noted either. Alright, I'm also checking for swelling or tenderness within the feet, and there's none noted. Next we're going to check range of motion.
Go.
Now we're checking for muscle strength within the feet, ankles. So I want you to press against my hand. Okay. Now keep your feet flexed like that. I'm going to try to push them down. Good. Patient had good muscle strength within his feet and ankles. Okay, we're not going to perform the McMurray test because my patient states that he has never experienced a trauma accident or a buckling or giving away, so there's no need for testing that. Okay, now we're going to inspect the spine. I'm going to look at it from the back and follow an imaginary line vertically from the head down to the toes. I'm going to note equal positions between the shoulders and scapula and iliac crest and gluteal folds, and note if there's any difference on each side. Okay, there's a slight deviation in the spine towards the right, being that there's more space on the left side. So that's not normal. Okay, now we're going to check range of motion of the spine. So I want you to bend forward and touch your toes as best as you can. I'm going to check along the curvature of the spine, which looks normal. So you can stand back up. And I want you to try to bend back as best as you can. That's good. Okay? Now we're going to twist from side to side. Okay? And we're going to bend side to side like this. So the patient has good range of motion in his spine. Okay, now we're going to check the straight legging test for pain in the lower back. I'm going to keep your knee straight and raise your leg and tell me if this produces any pain, okay? No? Patient reported no pain, so this is normal.